Well, new at 6, taking a look at the latest COVID update in South Carolina. More than 10,000 new cases today. The state is less than 4,000 cases in terms of reaching that 1 million mark. Current percent positive right now, you can see on your screen, 32.9%. In North Carolina, the total daily cases shot up again to more than 35,000. The percent positive is now at 34.3%. The number of people being treated right now for COVID-19 in area hospitals also up just in the last 3 days, currently at 4,800 patients, the highest it's been in 2 months. Well, right now, a call for help from hospitals in Charlotte that are now being overrun with COVID-19 cases. Queen City News reporter Robin Kennedy is live tonight at Atrium Health just outside of Uptown. And Robin, when will the help come from the federal government? That is the question everybody has tonight to be able to find out more on that. What can you tell us?
Alicia, we don't yet know how much help, if any, the federal government will give Charlotte area hospitals. But according to state documents, right now, this hospital region has the highest COVID numbers in the state. North Carolina is sounding the alarms, calling in the federal government to send 50 medical workers to help out at Atrium hospitals in the Charlotte area because of a surge in COVID cases and a decrease in staffing.
You know, one of the places that we know we first see strain is, for example, the emergency department. So working to support staffing there. And so we are working to, continue to assess what's needed and then work with our federal partners to see if there's additional support that can be brought in.
DHHS says Atrium Health is currently above 95% capacity and that the state, in partnership with Atrium, is calling on the feds to help beef up its hospital staff. The state says Atrium Health has tried several things, including redeploying staff from urgent care and outpatient centers, limiting non-urgent procedures, and closing specialty centers, but they still need help. Dr. Julie Swan is an expert on health systems in North Carolina.
What we do know is that when hospitals get full, mortality increases from all causes. So that could be from a car wreck or a heart attack or something else, but your care could be a little bit more delayed than what you would have had otherwise. And sometimes that delay is critical.
According to the request for help to FEMA in the Metrolina Healthcare Preparedness Coalition, which includes Atrium and other Charlotte area hospitals, the region only has 8% of staffed ICU beds available and 18% of total inpatient beds available.
There just is not capacity to send from one hospital to another, from one state to another, or even to use traveling nurses, as a lot of hospitals had been doing.
Now, that expert also telling us that there are very few resources, even from the federal government. The state says it is now waiting to hear back from the feds on Atrium's request. And we wanted to get an interview with Atrium to find out what is going on inside the hospitals, but no one was available today for an interview. I'm live in Charlotte. Robin Kennedy, Queen City News.